Welcome to the ECQM Fire Sparks. This series is presented by the Centers for Medicare and Medicaid Services. It is intended to support healthcare quality leaders, health IT vendors, and measure developers begin to explore the use of fire for quality measurement. We hope this series sparks your interest and engagement in this emerging area of interoperability. In this session, we'll take a closer look at the QI Core implementation guide and how to represent different types of encounters used in quality measures today. Current quality measures, whether they are being used within a healthcare institution or reported to a federal agency, will often look to see if a certain type of encounter occurred during the measurement period. This is done for a multitude of reasons, to determine if the patient was admitted to the hospital or seen for a follow-up after an initial assessment is performed. Let's take a look at the first example now. First, we'll refresh our knowledge on the QI Core encounter profile. If we review the snapshot table in Must Support view, we can see there are many elements on the profile that can further help us specify information about our encounter. Items like status, priority, diagnosis, and location. As a measure developer, it is important to note that while the snapshot table for any QI Core profile shows the available elements on the profile, the Must Support view will show you those elements noted as Must Support. In other words, it means that systems like EHR vendors that say they conform to that QI Core profile will support that element. Another important reminder is the cardinality column. Remember that the cardinality shows us if the element is required. For example, the participant cardinality of 0 to 1 indicates that no participant is required, but no more than one participant can be supplied. Let's compare the differential snapshot and snapshot must support tables. The differential table shows how the items in this encounter profile differ from the US Core encounter profile they are based on. As we recall from our last session, the snapshot table provides further definition on how data within the profile are structured. The snapshot table also shows all the available elements on the profile. Those items with the red S box are must support items, items that a system must support if they are going to attest to conforming to a profile. Finally, if we move to the snapshot must support table, we note that the red S's are no longer present. That's because all of the items on this table are noted as must support. From a measure development perspective, we can see that this list is a great place to start when we are thinking about how to model encounter information. Digging deeper, we see that those items with a cardinality of 1 to 1 are also required. As a measure developer, we need to plan to address those in our encounter description. Those elements are status, class, and type. Let's now visit the Patterns page of the QI Core implementation guide to get ideas on how to best model different encounter types. The examples on these pattern pages have been developed by other quality measure and clinical decision support developers. Like in other design efforts, it can be helpful to see how others have designed their content before embarking on your own journey. Let's start with an inpatient encounter or a hospital admission. We can see in this first example that the inpatient encounter has two elements that we are familiar with from the snapshot table: status and period. These elements are further described in the example. We can see that the status is set to finished, indicating that the measure is looking only for those inpatient encounters that are finished. In addition, the next line is using a function, length in days, to find the period of the encounter that is less than 120 days. That's a brief introduction to representing an encounter using QI Core. We hope you found this video helpful. For a deeper dive, we recommend viewing a webinar authoring ECQMs using the FHIR standard, which is available on the ECQI Resource Center and on YouTube. You can find the QI Core Implementation Guide here.